The Biden administration is marking a new milestone in the nation's fight against the coronavirus. President Biden announced that the nation has administered 50 million doses of coronavirus vaccines in his first 37 days in office, which means he's likely to reach his goal of 100 million shots in 100 days. As of Thursday morning, more than 46 million people had received at least one dose of a vaccine, and more than 21 million are fully vaccinated. Meanwhile, a new homegrown variant is causing alarm here in the United States. It was discovered in New York City and shares similar mutations to the more contagious strain found in South Africa. And scientists working on the AstraZeneca vaccine in the UK tell our own Charlie D'Agata they're racing to stay ahead of dangerous new variants. We'll have more on their work in just a moment, but we begin our coverage with Meg Oliver in New York City.
Tonight, an East and West Coast punch of new COVID variants. First, a new strain in California, and now a homegrown mutation is spreading in New York City. Dr. David Ho's team at Columbia University was one of the first to detect the mutation, noting similarities to the more contagious South African and Brazilian strains.
We don't know whether it's more transmissible, but we see it rising in prevalence within our patient population.
Dr. Ho says the mutation, seen here in red, alters the spike protein, which enables the virus to dodge antibodies. That could result in a weaker immune response.
So if you've received the vaccine, you could get reinfected.
We don't know that for sure, but the South African study with the South African variant showed that the protection drops from 90+% to about 49%.
Tonight, the FDA approved Pfizer's request to store its vaccine in pharmacy freezers for 2 weeks instead of ultra-cold specialized units. This as Pfizer and Moderna are testing whether a booster shot of their vaccines can protect against the variant identified in South Africa.
What we care about is making sure people don't get sick, they don't get hospitalized, and of course, most importantly, that they don't die.
Still, the death toll in California reached new heights today, the first state to surpass 50,000 after a backlog of reported deaths. It comes despite a steep drop in cases, hospitalizations, and deaths nationwide, especially in nursing homes where deaths are down 66% in long-term care facilities. Today, President Biden marked the cusp of 50 million first-dose vaccinations with a ceremony of shots going into arms.
And the more people get vaccinated, the faster we're going to beat this pandemic.
The halfway point to 100 million doses in his first 100 days. Meg Oliver, CBS News, New York.
I'm Charlie D'Agata in Oxford, England, where AstraZeneca tells CBS News they expect data from U.S. trials in the coming weeks to present to the FDA for emergency approval. Oxford scientists say the vaccine has already tackled what had been the runaway UK variant here. Real-life data showing it kept hospitalizations down by 94%, even outperforming the Pfizer vaccine.
We've seen the first widespread use of a vaccine in a setting where there's a new variant that's emerged. And the vaccine has impact against that variant that is astonishing.
The team here telling us they began the fight back against dangerous new variants months ago.
Development already in the lab?
Yes.
Including the South African?
Oh, we started in December. We started working on new variants in December.
Oxford vaccine developer Professor Sarah Gilbert told us a modified vaccine could be rolled out in the U.S. in a matter of months.
By the fall?
The plan is to have a new version of the vaccine available for the autumn, I would call it, of this year.
The professors told us that the 12-week gap between doses here in the UK is better than the 4-week plan, which is standard in the U.S. More people are immunized in the short term, and that reduces the chances that the virus can mutate. Lana?
Charlie, thank you. For more, let's bring in Dr. Richard Besser. He is the president and CEO of the Robert Wood Johnson Foundation and the forming acting director of the CDC. Dr. Besser, always a pleasure to speak to you. So we are getting real-world data on these vaccines now. What does this data tell us that we didn't learn from the lab studies?
Well, it's pretty exciting. When you do a controlled trial, the researchers are trying to control for every factor. They're very careful about who gets into the study, They're very careful about follow-up. And once you then release a vaccine into widespread use, you have the ability to see, well, does it work just as well in the general population as it did in a special study population? And what they found in Israel with more than 1 million people in this trial was that the vaccine worked just as well, greater than 90% effectiveness after the second dose. And that's great because there were a lot of people in the study who had multiple medical conditions, and this gives you a better sense in terms of across nations how this vaccine is going to perform.
So let's talk a bit about how these vaccines are helping to lead us back to some definition of normalcy. We know that the vaccines help to prevent the severity of the illness, but can you talk to us a little bit about how they're able to potentially also prevent infection? Obviously, that is the key when we're talking about eventually being able to reach herd immunity.
Yeah, so that is one of the things that they tried to look at in this study. Does it prevent asymptomatic infection as well as symptomatic infection? And in this trial, they found that it did. That's an important piece of information because we clearly know from the vaccine trials that the vaccines are effective at keeping people from having severe disease, keeping people out of the hospital, and preventing deaths. If it's truly clear that these vaccines prevent transmission, then you're going to be able to tell people who've been vaccinated that they can resume a more normal life. You're going to be able to say to people who are fully vaccinated that when they're at home with people, they may not need to wear masks. So this is the kind of data, the kind of information that will help inform public health recommendations going forward.
That's such encouraging news, and I keep trying to check myself that I don't become too excited because even as the U.S. has been seeing a decline in cases overall, there are still more than 74,000 cases that were confirmed on Wednesday alone. And some experts are warning, as you know, about a third surge being driven by variants, and they say that that could potentially hit us mid-March. How concerned are you about this potential for another variant fuel surge?
I'm very concerned, and I think that it's the reason why we can't let our guard down. We have to keep up what we're doing in terms of wearing masks and keeping apart and washing our hands and limiting our travel. What we saw in Europe when in England or UK they identified the B117 variant they saw a rapid rise in the number of cases. And this is a variant that we're seeing in more places in this country. So until it's clear what this is going to do, we can't let our guard down. We have to continue to focus on getting as many people vaccinated as possible. We have to focus on getting people who are going to work every day vaccinated, are essential workers. A large proportion are people of color who've been hit so hard by this pandemic. And we have to make sure that everybody does their part in terms of following the recommendations of public health to reduce the transmission that's going on in communities.
So I'm wondering if people are following those recommendations and social distancing, washing hands, wearing double masks, and more people are becoming vaccinated, I'm wondering how that affects reopening plans, because cities across the U.S. are continuing to ease restrictions. As you know, New York Governor Cuomo says movie theaters could open next month. Do you feel like we are on track and that all of this is appropriate, or are you concerned about potentially moving too fast out of a pent-up desire to get back to normal?
Yeah, I mean, everyone is so tired of this pandemic. We all want to get back to the activities that we enjoy. But I think we have to be really careful here. The percentage of people in our country who've been infected it tells us that there are still hundreds, over 100 million people who are susceptible to this virus. The number of people vaccinated, it's going up, but there's still so many people who are susceptible. So I would really urge caution. I think it's exciting to think about children getting back to school and learning, in-person learning, and we need to do everything we can to get kids back into school. But some of that may mean that we have to go slower on community activities that could increase transmission in our communities and make it harder to get children in school for in-person learning. There's a lot here. It's learning as you go, but we have to be very careful and not take this virus for granted. It has shown that it can come back when we think we're heading in the right direction. I'm cautiously optimistic that we are on our way out of this, but until we see what some of these new variants do, we really need to be very careful.
I will take cautiously optimistic at this point. All right, Dr. Richard Besser, thank you.
Thanks so much, Lana.